Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Propranolol. Its brand name is Inderal. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how propranolol works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe propranolol. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does propranolol work? Well, propranolol is a non-selective beta blocker. It competes for available binding sites that stimulate the beta adrenergic receptors. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure, as well as for migraine prophylaxis or prevention. Patients with an essential tremor may use this medication, as well as patients who may have anxiety before public speaking. Chronic angina pectoris or chest pain may be treated with propranolol, and there are also some other indications. With respect to contraindications or reasons we would not be able to prescribe propranolol, we wouldn't give this medication to a patient who had a hypersensitivity to propranolol or any other component of the formulation. If a patient had cardiogenic shock or sinus bradycardia with no pacemaker, they would also not use this medication. This medication will be contraindicated in patients who have second or third degree atrioventricular block, as well as overt cardiac failure. And finally here, patients with a heart rate less than 80 beats per minute would also not use propranolol. And again, this list is not all-inclusive. There are some other contraindications as well. Now what about dosing with propranolol? So in the treatment of hypertension or high blood pressure, we may see an initial dose of 40 milligrams orally twice daily. Then with a maintenance dose of 120 to 240 milligrams orally daily in 2 or 3 divided doses. The maximum dose would be 640 milligrams per day. Again, this would be given in divided doses. Now for migraine prophylaxis or prevention, we may see an initial dose of 80 milligrams daily in divided doses, and the maintenance dose would be 160 to 240 milligrams daily in divided doses once again. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using propranolol, so I'll go over some of those here now. Some patients may experience diarrhea or vomiting. 4 to 7% may experience dizziness. Some patients may experience a sleep disorder, and 5 to 7% of patients may experience fatigue. Now, some more rare but serious side effects would be a bradyarrhythmia, hypotension or low blood pressure, or hypoglycemia, low blood sugar. That's all we're going to talk about today with propranolol or Inderal. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.